Hello, today I'll be talking about major depressive disorder. So, major depressive disorder, also known as MDD, is also known as a clinical depression. According to the Mayo Clinic, major depressive disorder is defined as a mood disorder in which an individual presents with persistent feeling of sadness and loss of interest. Signs would be feelings of sadness, tearfulness, emptiness or hopelessness, reduced motivation, decreased pleasure in things once found pleasurable, weight loss, altered sleep patterns, fatigue and loss of energy, feeling of worthlessness or guilt, impaired cognition, and thoughts of death and suicide. Occupational therapists help the individual with major depressive disorder participate in activities of daily living such as dressing, bathing, toileting, grooming, feeding, and sleeping tasks. Depression affects all activities differently depending on the severity of the symptom and episode. Occupational therapists can help individuals notice when symptoms start. Occupational therapists can help an individual know what steps to take when the symptoms do start to occur. A client with MDD will be taught by OT, energy conservation techniques, and how to use reminders to take medications and how to use them to remember appointments. A client will also be educated on techniques that they can use to be able to safely participate in social activities. And they will also be encouraged to express themselves, to eat a healthy diet, to sleep and participate in group activities, and also to take some exercise, which will help them to feel better. A major depressive episode can be avoided or prevented by doing deep breathing exercises, making lists and crossing items off when the task is completed, and by exercising also. By using the list, this provides positive feedback that will help to add to their self-esteem. Another important technique is one of making plans. This helps them to stay on task and to remain productive. OT interventions aim at promoting a healthy lifestyle, high self-esteem, acceptance of individuals, and support resources for those who need it. OT interventions also focus on preventing the depressive episodes. They look at those who are high risk for them and provide them support before the episodes occur. This includes using small groups that will help them to talk with people who are also experiencing what they are experiencing. Patients will also be taught new coping methods such as deep breathing, talking with someone, keeping a journal, and walking, as the techniques that they are using now may not currently be assisting them. Interventions for the family. The family will be taught about information, signs and symptoms of depression so that they can notice when their loved one may be experiencing it. The family may also feel lost, and they will be encouraged to speak with someone and to utilize resources that are out there for those members or for those who have family members who are suffering from depression. They will also be encouraged to use respite care, to take breaks for themselves so that they can better help their loved one. I want to thank you for listening and hope you have a good evening.